if you're able to, when moving around the building, which has a one-way system, the exit being over to the door on my right. Can I ask any mobile phones to be turned to silent, please? Thank you, Chair.
Thank you, Peter. So welcome everybody to the Liverpool Health and Wellbeing Board, which is being live streamed on the council website. So what I'm going to do is start with asking everybody to introduce themselves with their name and their role as we go round. So, Councillor Lake, do you want to start?
Yeah, Councillor Fraser Lake, Councillor for Fazaki Ward and Cabinet Member for Social Care and Health.
Thanks, Fraser.
Matthew Ashton, Director of Public Health.
Cheers, Matt.
Fiona Lemons, GP Clinical Chair of Liverpool CCG.
Councillor Richard Kent, Leader of the Liberal Democrat.
Thanks, Steve.
Paola Parvulescu, Consultant in Public Health.
Sorry, say that again, Paola.
Paola Parvulescu, Consultant in Public Health.
Thank you.
Jack Morton, Senior Public Health Consultant. Oh, sorry.
Sorry, go on.
Jack Morton, Senior Public Health Consultant, Liverpool City Council and Alder Hey Children's Hospital.
Thank you, Jack.
Lead for Health Inequalities.
In which case, you're very welcome, Kirsty. On the right-hand side. That's it.
Oh, this one, isn't it? Claire White, Chief Executive of Liverpool CBS.
Thanks, Claire.
Ben Barham, Press and Public Health, University of Liverpool.
Cheers, Ben. All I could hear was Ben Barr and then a whole load of blah, 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 blah. Do you want to just say that again?
Professor in Public Health at the University of Liverpool.
Thank you, Ben.
Thank you.
Sarah Thwaites, Chief Officer, Health Watch Liverpool.
Thanks.
Bernie Davis from the Council's Benefit Service.
Cheers. I think that's everybody, isn't it? Yep. Okay. Apologies have been submitted by Mayor Joanne Anderson, Councillor Tom Logan and Chief Executive Tony Reeves. Have we got any other apologies, Peter?
Martin Farron and Joe Rafferty.
Okay. I'm afraid the camera doesn't work, so when you speak, it stays on me. Problem. Okay. Minutes of the last meeting held on the 16th of June are on pages 1 to 16 of the agenda. Are there any accuracy issues or matters arising that members wish to raise? Accuracy issues first.
Please, Chair, I can't work out which number it is, but...
Okay. Okay, so... Okay. So, we'll carry... I don't think we can hear protesters much. You can hear a little bit in the back. All right. Okay, cheers, Steve. And it's about vaccinations, or it's about... Do we know?
Just almost.
Raise something, Chair, on one of them. At the last meeting, I asked, how do we get agenda items on to this agenda? And the Mayor referred it to a group leaders meeting, but that never took place. So I do have two items which I'd like to put on the agenda that I'd like to raise today to come forward to a future meeting. The first, and it partly gets picked up in a later paper, but not satisfactorily, is the relationship between the primary care networks, counsellors, and other organisations within PCN areas. I have raised this 7 or 8 times here with no resolution and no invitation to do anything to happen. The other one that is the one that I keep getting raised and mightn't be answered now, but there is a lot of concern about, and that is how GP services are going to be run in the future. Will it always be triaged by phone, which I personally think is a good idea. So this isn't me saying it. I had an excellent experience, all dealt with in about 10 minutes flat. But a lot of people want to go back to the GPs. I think I'd like to see something coming forward from the CCG saying this is what we're trying to do, this is what the timetable might be to try and get that reassurance out.
Okay, thank you, Councillor Kemp.
I think
Did you want
Fiona maybe has got a view about PCNs and the relationship with councillors, and absolutely agree we want to improve that relationship, particularly at PCN level with communities and local leaders. In terms of the approach to general practice, we are aware of the increase in anxiety and concern from the public and from a number of constituents. We are going to do some proactive communications out about general practice, the reasons why we continue to operate in a particular way, partly because the pandemic has not gone away. And for most of our patients that go to general practice, they're pretty vulnerable. And what we want to do is protect them, those people who do need face-to-face appointments, when they're sat in a waiting room, and we can organise our care and our health professionals appropriately around the most vulnerable in our communities. So it's a bit of a bear with us. It's a bit of, we know it's not ideal, it's not what everybody wants, but it's probably at this point in time the safest and most appropriate use of that resource. So that communication we're working on at the minute, we're more than happy to share with Health and Wellbeing Board members once that's agreed, and we will share it with councillors more broadly so that they are aware when they are asked what the issues are, that they've got that to hand so that they can share that with people that are raising concerns. We'll share it with MPs as well, because some of the concerns they've got have come through MP inquiries.
Anything you need to add, Fiona?
Thank you, Chair. I wasn't sure if you were going to take this item just now or whether that was actually a future agenda item.
It is. So I'm wanting a quick response, and then I think what we'll do, Richard, is we'll have an update at the next meeting and go into it in depth then. But a short response.
More detailed response, certainly.
Yeah.
I have shared your concerns. You're right. You've raised it multiple times about the connection with the PCNs, and it is absolutely not down to an unwillingness to engage, and is entirely down to the fact that they are drowning in work, and the list of priorities that they have is just longer than they're able to get to. But I will. Well, you're not. You're lower down on it, along with a lot of other things.
Okay.
But I will raise it with them again.
Okay. So Peter, have you got enough of a note there to be able to minute that, and then and then we'll make sure that it's on the next agenda, Councillor Kemp. Okay. Otherwise, any other matters arising from the minutes? No? Can we agree the minutes then? Agreed, thank you. Okay, on submitted questions, this is number 4, item number 4. So there were submitted questions that came in yesterday, 2 of them. To make sure that we have enough time to be able to respond properly and carefully, I'm going to suggest that actually, and that's both for the public, our citizens, and also for officers, I'm going to suggest that we use the standard procedure that we have for the other select committees, which is a requirement of 5 days notice for the submission of questions, which then gives us time to be able to turn that around properly and carefully. In the meantime, there will be a response to those questions. They will be emailed to the questioners and appended to the minutes of this meeting. Is everybody in agreement with that?
Yeah, agreed.
Yep, thank you. Okay, and then we're on to item number 5. So this one is update on the Marmot Community Programme, but there's also, this is linked directly up with number 6 as well, which is impact of universal credit reduction on food poverty. So as you know, we used to have a fairness and tackling poverty strategy group, which the Bishop joint chaired with me. That is morphing into the Marmot Community Subcommittee of this board. So what's useful with that is it comes directly into the Health and Wellbeing Board, and we can see what's happening. We can see where the gaps are. We can see what we need to prioritise on. The first of these two is the Marmot Community Programme, and that's on pages 17 to 20. Gavin, do you want to just say a few words about that, and then I'll move on to the main issues there.
Yes, certainly. So in terms of the Marmot communities, a paper came last summer in 2020 that summarised the goals of the Marmot work and what we're trying to achieve. So that's all within the paper, so I won't go into detail about that. Since then, Cheshire and Mersey are putting together to become a Marmot communities, achieve Marmot community status. So, as outlined in the paper, one way to do it, we know we've got people working across Liverpool looking at improving inequalities and tackling inequalities. What we'd like to do is pull a workshop together that acts in two ways. It can feed, there's a national review going on Marmot that's due in early 2022. So a Liverpool workshop will allow us to feed into that process, the national process, and there'll be similar workshops held across the Liverpool City region and Cheshire, and we'll feed into it. But also we want to use that workshop as an opportunity to bring people working together in these areas, across organisations, across sectors, to set up a working group that can push the work forward. So set out a defined work programme around Marmot and what we want to achieve. We'll see that linked in with our status. So the paper is really asking for permission to hold that workshop, and then following that we'll put the team together that will bring regular reviews back to the Health and Wellbeing Board.
Lovely. Any questions for Gavin on that? So as you know, the Marmot actions are really, really important, the 6 policy actions. And for those that are listening into the live stream, they don't go near any silos. They basically talk about people and communities and the place. The one out of the 6 that the government hasn't signed up to, although when it first came out in 2010 under the heading of Fair Society, Healthy Lives, all of the actions were signed up to by all the parties. But with this government, they haven't signed up properly. In fact, they haven't signed up at all to ensure healthy standard of living for all, which is absolutely key if you think about it. Okay, and it also talks about the role of local authorities as well, which actually would be quite nice pieces to make sure, and Gavin, that we link in there, because Michael Marmot made a good statement about that. Not in running things, but helping to coordinate, which is great. So the Marmot workshop will happen in October, and that's absolutely crucial for Liverpool. And then we'll be able to feed in then to the rest of the region. Okay, on number 6, right, this one is impact of universal credit reduction on food poverty. What we're going to do is I'm just going to start off with 3 slides at the front, and then I'm going to ask Bernie to give us the rest of the presentation, if that's okay. So do you want to put the first one on? That's it. Okay, so looking at food poverty, food insecurity, the Food Foundation, the Chief Exec Anna sent me these through the other day, and she's looking to come up to Liverpool either October or November, so we'll feed that through the Marmot workshop and see if that works with that or whether that needs a separate way. And they've been running the Children's Right to Food campaign, heading that up since 2018. They've also been heavily linked up with the National Food Strategy. So they're a really good group to be able to be linked up with. So thanks to Anna for that. So the broken plate, they always bring out a report every year. And this is, and it's called the broken plate, and it's the affordability of a healthy diet. So the government bring out the Eat Well guide. And they say that for people to be able to eat well, they define it. If you look on the left-hand side of that graph, on the bar charts, you can see the difference between 1718 and 1819, and obviously it's a lot worse now in 1920 and 2021. And what that shows is the people on the lowest incomes have to spend that amount of money, their disposable income after housing costs, on reaching that Eat Well target that the government has set. So after your housing costs, you're having to spend 40% if you're on the lowest income, which is totally unachievable. Now the government know that, we all know that. And then as you get richer, you spend less, or you need to spend less to reach that. Okay, could I have the next one, Bernie? This one shows less healthy food and more healthy food and the cost of it. So you can see it's much more costly to buy in healthy food than less healthy food. Okay, and the next one. And this is interesting. This is how many people within the food sector, if you like, are on a real living wage. So £9.50 an hour, unless you're in London, which is £10.25, I think, £10.50. And that shows there you've got, I can't read because I've got my glasses on, but you can see the majority of them are well under the real living wage. Thanks. So that's the backdrop to food insecurity. IFAN, the Independent Food Aid Network, Sabine, who runs that, states very clearly that the food networks across the country, the independent ones, are saying it has to be a cash-first approach. We can't go on and on and on, going downstream, providing people with food, when actually they need money in their back pocket to be able to choose the right food and to have it accessible. So what we're doing in Liverpool at the moment to make sure that people have got a cash-first approach, and the backdrop to that is what Bernie's going to go through now. There's a lot of slides here, but Bernie's going to wing his way through. Is that okay?
Yeah, thank you, Chair. There are a lot of slides, so please bear with me. I think I've got 10 minutes, so I'm going to rattle through quite a few of them, so forgive me if I miss a bit of detail. But what I'm going to do this afternoon is just talk about a little bit about the support that's provided from the council in terms of assisting those most vulnerable households across the city. I'm going to try and provide a bit of context, particularly with COVID pandemic and what's actually happened to that support during that period of time. And also look forward to the next couple of months, which obviously is going to be quite a number of challenges, both for us as organisations, but obviously more importantly, the citizens of this city, really. So the first slide I've got here is just a quick overview on the types of welfare support that's provided by the council currently. There's 5 areas chiefly. There's the Liverpool Citizen Support Scheme, Discretionary Housing Payment Scheme, Council Tax Support, currently test and trace payments, which were based within the Revenues and Benefits Service, which we're administering. I'll go into a bit of detail on that. And then we have a benefits maximisation team who look to try and contact households and provide financial support and advice on the benefits system. So just to provide a bit of context, really, I think it goes without saying that COVID's had a significant impact in terms of poverty. Nationally as well as locally, significant reductions to the economy, lots of sectors closing down, and that's had a knock-on effect with employment. And I think it's suffice to say that those people who've been in the most insecure employment on lower incomes have been the hardest hit. I think that was expected, and that I think has been borne out over the past year, 18 months or so. And initially, the council, and particularly the welfare support we were providing, saw a big spike in demand as the pandemic hit. So in the first early months, April and May, we saw a spike, and then that settled down at quite a high level, but it stabilised and plateaued. But we started to see an increase over the past couple of months, and there's an expected a significant surge between now, Christmas and beyond, as Farron, amongst other things, come to an end. And I think one of the things that's quite key here is that we continue to provide quite a significant level of funding as an authority, really, to a lot of vulnerable citizens across the city, and more than a lot of big local authorities across the country as well, which I'll go into in a bit more detail shortly. So just a quick overview. Liverpool Citizen Support Scheme provides 2 types of awards: the Urgent Needs Awards, which is low value, up to £100, emergency payments to enable residents really to purchase food and fuel. And then we have Home Needs Awards, which effectively are white goods and furniture items to enable people either to move into a property or to maintain a tenancy, really. So it'll be simple things like, fridges, cookers, microwaves, etc. Unlike other local authorities, Liverpool continues to provide quite a lot of financial support within the Liverpool Citizen Support Scheme. It's not a mandatory scheme. It was initially with the DWP in 2013 and passed across the local authorities who had responsibility for administering payments of this scheme. And at that time, the actual funding was ring-fenced, but since that time, it's actually gone into the general fund, so the council has to provide funding from its general fund to actually meet the needs of this scheme. Just touching upon the expenditure, 1920 we spent £3.4 million, in 2021 £4 million, and we anticipate it's probably going to be somewhere in a region between 3.5 to 4 million in the current year as well. Initially, we identified that demand to the scheme was suppressed really in the first couple of months. We think mainly because of the fact that people were not moving home. So a significant part of the scheme is providing home needs awards, so fridges, cookers, furniture items. And because there was a suspension on evictions and because people were not moving properties, there were less home needs awards applications made to us at that time. So demand in the first couple of months was quite low. It then spiked and stabilised, like I said earlier on, but we anticipate that demand will start to increase from this point onwards, and predominantly due to those 4 bullet points. So an ending of furlough, the £20 per week cut to universal credit, an expected increase in evictions because evictions were suspended up to August. We are now starting to see people be evicted, and we think that will continue in the lead up to Christmas and beyond. And the ending of business grants as well, which will have a knock-on effect to employers and ultimately employees. So there's a significant amount of latent demand out there, which we think will start being realised over the next couple of months and start presenting at these welfare support schemes that we administer within the council. That's just a quick slide, and I have to apologise because there's an error on this slide. The colours are the wrong way around, so the sort of browny amber colour should actually be home needs awards, which is the emergency payments, and the urgent needs awards are the bigger ones, the purple ones. You tend to find that the urgent needs awards, because they are low cash value, they tend to be a lot in number but low cash value, where the home needs awards are lower in number but significantly high in value because it's furniture and white good items. But you'll see on the right hand side, in terms of particularly the gold one, brown one, we're already at 70% of the previous year in the first 4 months of this year. So it's likely to continue to increase in the, as I said, the build up to Christmas. One of the other schemes we administer within the council is discretionary housing payments, and it's short-term financial support to make up shortfalls in people's rent. We receive an allocation from the government every year, and we top it up as a local authority. We can top up to 2.5 times the amount that the government have given us. And you'll see in one of the later slides, the actual government allocation is reduced over the past couple of years and continues to reduce as well going forward. Again, similar to Liverpool Citizen Support Scheme, the demand during early lockdown was quite suppressed, mainly because of a lack of home moves and suspension of evictions, but that's now started to increase quite a lot. And the main drivers for DHB for us are predominantly in the past being the bedroom tax, but more recently the benefit cap and other welfare reforms, specifically universal credit, beginning to be more of a high-profile application to the system. So bedroom tax is lessening in sort of significance, and universal credit and other welfare reforms are beginning to take hold. That's just a bit of a busy slide, but it'll give you a bit of an idea in terms of the bar chart. The darker ones is the government grant that we receive every year. The green ones are the amount that's paid in excess of the government grant, and in essence that's the council allocation, so the amount that we pay over the government's amount, and then the total expenditure is the sort of the brown and orange bar. The linear is actually the government allocation, so you will see since 17-18 the government allocation for funding in this area is reducing and continues to reduce, and we expect that to continue in the next financial year too. We've got a council tax support scheme, which is mean tested benefits and provides people on low incomes with a discount in their council tax bill. Akin to all the other ones that we're providing, stabilised recently, so it's plateaued in terms of our caseload, but we expect a further surge in the autumn and winter of this year. We've got about 69,000 people in Liverpool currently claiming council tax support, and it continues to be vital support, particularly for those people who are in work. We've got a lot of people who actually claim council tax support who are in work, and it costs the council about £70 million a year to deliver this scheme. Just a little bit on test and trace isolation payments. So we're actually administering this on behalf of the council. So there's two elements: mandatory scheme and a discretionary scheme. The mandatory scheme is where people meet the criteria and are on the qualifying benefits, and the discretionary scheme is where they meet the criteria but may not be on a qualifying benefits. So, for example, they may be in work but on a really low income, and it's up to the council to decide whether they support these households. So grants are £500. There's certain criteria that has to be met, including that people need to be on a low income, in work and unable to work, and also losing income as a direct result of isolating. And since September 2020, we've issued the figures there of £1.2 million for the mandatory scheme and £1.1 million for the discretionary scheme, and we'll continue to obviously administer that until the scheme ends. And last couple of slides, we have a benefits maximisation team within the council that provides advice and take-up for support for citizens, specialist benefit advisors based within the benefits service, and we're seeing now probably more complex and wider issues coming to the benefits maximisation team, predominantly because a lot of people who wouldn't normally claim benefits are claiming benefits, so they're brand new to the system and need quite a lot of support going through to claim the benefits for which they're entitled to. We're also seeing the reopening of the DWP disability assessment centres and the knock-on effect that they are having, because a lot of people are being refused benefit through these assessment centres, and then the benefits maximisation team will assist somebody going through an appeal process. So we're seeing more and more people approach us for appeal support. And then just a few facts and figures in relation to what's happened in 2021. We've seen 5,300 customers referred to BMS, and we've supported about 2,100 people, identifying over £10 million in extra entitlement for all of those as well. So it's quite a big service. And again, it's in support of those other services, Citizen Advice Liverpool and Raise, which we know do a similar thing across the city. We work hand in hand with those organisations just to make sure there's no duplication of effort. So if we pick up a customer, we'll alert those organisations to that fact, and vice versa. And then just moving forward, just the final slide is about some service pressures and challenges which we are mindful of, really. Obviously, there's council budget pressures. There's a lot of financial support being provided by the council for these particular schemes, but they're obviously under pressure as the council budget is under pressure as well. We've got an ending of furlough that's upon us. Evictions have started again in August and they're starting to impact. We've got a few things which are about to hit, which is the £20 impact on universal credit, and it's been recognised by the government's own agencies that that's likely to hit the lowest income households within the country. And then we've obviously got the ever-present problems in relation to low income, insecure work, 0 hours contracts, and obviously as the pandemic begins to really harden and bite, we're seeing that the lowest paid, and particularly those who are in receipt of universal credit, are coming to the council for more and more support. And interestingly, we've started to see probably a break in the link between the levels of social security benefits and what people need to live on. There's been obviously cuts and changes to UC since it was first identified and designed, and it's in a different place now than it was meant to be. And as a consequence of that, we're finding that more families and individuals are coming to the council for support that they can't get from the DWP. So quite a few challenges ahead of us, really, within the next couple of months and certainly within the next financial year. And those challenges are obviously are really hit harder with COVID as well, and how COVID presents for families and households. But ultimately, I think the bottom line with it is some of these things are beginning to have an increase in the sort of impact on health for families and individuals. There's stress and anxiety which is beginning to manifest, and that has a corresponding effect on obviously all the organisations and the individuals who are here today. So sorry about the fact that it's a quick rattle through, but that just gives you a flavour in relation to the support that we're providing and some of the things that we need to be mindful of moving forward.
Lovely, thanks Bernie. Any comments or questions on that? Ben? Sorry, Ben and then Richard, sorry.
Thank you, Chair. Yeah. I'd just like to say that these welfare support schemes and welfare in general is just crucial for addressing public health and health inequalities. And when, with the research that we've done previously, where access to welfare benefits has been restricted, that has had a huge knock-on effect on mental health. And the commitment in Liverpool to local welfare schemes, I think, is really welcome and has helped to mitigate some of the negative effects of restrictions to national benefits. And I think it's really important that that commitment continues. Thank you.
Okay, thanks, Ben. And of course, we're moving into the budget position as well. Go on, Councillor Kemp.
Well, I was partly going to raise that, but whether it's the council, whether it's society or the government, we cannot continue with the piecemeal bits and pieces that are very difficult to negotiate. And Bernie was telling us that particularly if you're unemployed for the first time, I bet there'll be a load of them coming up as furlough ends. You just don't know where to go. If you've been unemployed, regrettably, for some time, you know there's a bit here, there's a bit there, you can ask them for that. But this is an absolute maze for people to negotiate. And when we meet next Wednesday, I was going to say here, but we won't be meeting in Overton Park as a council, there'll be another suggestion coming forward that we really need to have a universal basic income to strip all these things out. And if some people need more, it will be a relatively small number. And that's particularly true of some things that weren't mentioned there, like pension credits. So pension is going up, but a lot of pensioners can apply for all those things. If we had a proper pension, actually we wouldn't need any more money. It might just be that we're sharing out better what's there to avoid this ignominy of the means test. So all I'm putting a plea in, and I know I don't need to make it within the council chamber, and I suspect I don't need to make it here, but we have to have a much simpler system that would actually, I suspect, save us money in the long term, rather than this penny pinching Scrooge-like system that we've had for a long, long time. It gets better, it gets worse, but it's never actually dealt with the basics of what poverty really means.
Thank you, Councillor Kemp. I'm presuming that you're thinking the penny pinching is coming from the government, because we have our scheme is actually stitched together very, very tightly. So the LCSS scheme, citizen support scheme, once you ring up on that line, which has been free for a long time for mobiles as well as landlines, you are then in through that door, and then any other signposting that you need is connected through there. So we're one of the very few local welfare schemes that is actually being funded at that level repeatedly year after year. So we've probably spent in the amount of 22 million now out of our own money. Whereas what we're having through at the moment is one-off grants that we have to stitch together. So that's where what you're referring to, I presume. And the other thing to just let people know is that there is a living income campaign that I'm involved with at a national level that will be launched at the end of the month. And that will look at, and that's with New Economics Foundation, Liverpool, the Living Wage Foundation, and many others, that will look at actually just making sure, rather than having a conversation about do we go for universal basic income or another route, it's just saying we need a living income, whether you're in work or out of work. So your head is above water, your chronic stress and anxiety then start to reduce, and you can live your life rather than try and somehow survive year after year. Any other comments before we move on? Go on, Sarah. Yeah, thanks.
We're already noticing the impact on our inquirers' health and mental health of the resuming of the disability benefits assessments. And I suspect GP practices will be noticing too, because we've noticed people being extra concerned that they haven't seen the GPs in person because they think that some of the conditions won't be on the medical records. So I suspect that will be another pressure that adds to the increased burden on staff there.
Thanks. And I think, Bernie, the last count was 61,000 residents in Liverpool on universal credit.
Yeah, as at the end of August, there was 61,000, so it's increased quite significantly over the past year, because obviously people are coming out of employment, they're having to claim universal credit, so they're coming off legacy benefits. Yeah. So 61,000 at the moment, Jane, yeah. Okay,
of which 61,000 will get a cut on the 6th of October by £20. So that has to stop, however we do that. And the government needs to be ashamed of themselves on that one. Okay, next item. Yep. So what we'll do is we'll just keep going, just so that we can make sure that we get actions out of here, out of this Health and Wellbeing Board. We're going to do a slightly different framework from now on. So we'll be asking for actions on the basis of the reports that come forward. So, for example, with anybody that's employing people and does subcontracts, they need to be able to pay the real living wage and do also living hours, as it's called now. And we need to be able to track those collectively together so we can actually do a race to the top, not a race to the bottom. And we need to support purpose-led businesses, not profit-led businesses, so the money stays within Liverpool and it stays with the people that need it. So all of that is coming is being coalesced into a vision that actually we can all sign up to. So do have a think about that and see the barriers to that as well. We don't want people being under pressure. There was a story of one woman who actually died, who was on a cleaning contract. And she went to the hospital and a consultant said, "What are you doing here?" She said, "I can't afford to stay at home." And she had cancer. He said, "You need to go home," and she died. So it's that sort of stark. Okay, thank you very much, and thanks, Brendan, for the presentation. Number 7, long COVID, the impact on Liverpool's population. Paula, are you going to report this one for us?
Yes, thank you. So I will try to give a short overview of the paper, which is about the current impact of long COVID on Liverpool population and on the local systems response. So I will talk a little bit about what we know at the moment about long COVID in Liverpool, and then Michelle will talk about how we respond to that, so the NHS and the wider system response. So as we know, we had more than 71,000 people infected with COVID since the beginning of this pandemic in Liverpool. And one of the consequences of this is a significant number of people who then develop long COVID. Unfortunately, we do not know exactly how many people had or have long COVID at the moment. So we try to estimate that by using a methodology developed by Public Health England, and that's detailed in the paper. So using that methodology, our modeling estimates that there might have been around 14,000 people in the general population in Liverpool with long COVID, with symptoms more than 12 weeks after they were infected since the beginning of this pandemic. Obviously, these are dynamic data, so some of these people might have recovered, but this is the estimation for all people who had more than 12 weeks of symptoms since the beginning of this pandemic in Liverpool. Having said that, as I said, this is just modeling, so there are some significant issues with data quality and the multiple assumptions we have used for this paper. This is also emphasized by various other reports, one of them being produced by SAGE, and basically they are saying that this proportion of people who develop long COVID can range between 2.3 and 37%. So it's an emerging disease, an emerging science. What we know is that fatigue is the most frequent reported symptom, and also that there are significant factors, there are risk factors that we know about, and those include increasing age, being female, being overweight or obese, having pre-existing asthma, having pre-pandemic poor health, and being hospitalized for COVID. There is good news with vaccination, so the risk of long COVID may be reduced in individuals who become infected after being doubly vaccinated, but the evidence for that is just emerging now. As with many other diseases, there are significant inequalities. So younger age groups, so people under the age of 70 are more adversely affected by long COVID. Being a woman also is a risk factor. And we also know there is a clear social gradient in experiencing long COVID, with the prevalence being higher in those deprived parts of our communities. Also, as I said, long COVID is more prevalent amongst people who had pre-existing health conditions. In addition to this, there are physical and mental health implications and social consequences for individuals and their families. People might lose income, people might not return to their jobs. The system has responded to this in Liverpool, and Michelle is going to talk about the NHS response.
Thank you, Paula. My name is Michelle Timoney and I work in Liverpool CCG. The NHS in Liverpool has got a 4-tiered response to support people who've been affected by long COVID. The first tier is self-care, and what we're doing, we're promoting the national resources and materials on the My COVID Recovery platform, which are accessible via the internet. It's very much a kind of self-serve model, but we're very, very keen that we signpost and support people to access that. And I think that's predominantly for the group who, maybe have some time limited kind of after effect from their COVID, but it's also a useful resource as people go through their long COVID journey. The second tier in Liverpool, 100% of our GP practices are signed up to this, is that all our GP practices are going to be delivering some long COVID support to their patient populations. The requirements are, first of all, good data collection, because as Paola's sort of demonstrated, we don't really understand the extent of the problem and also kind of what the recovery rate is like. And it's very hard to plan for services when you're not really sure the size of the kind of cohort and the different issues and needs in that group. So there's a real focus on data. The second focus is on pathways and making sure the primary care team, the local community team have got a pathway to enable people to access local support when they need it. The third aspect then is education and making sure that education is tailored to each member of that primary care team. So the good news is 100% of practice are doing that. The third tier of our model is an assessment and treatment multidisciplinary team for people affected by long COVID. We got money notified to us in July, and we've absolutely run at speed with this. And we've got a partner in the city that's actively working up the model. They'll be mobilising within the next month, and they're bringing in skills and teams from other organisations in the city to create the multidisciplinary MDT. And that's very much a focus on assessment and rehabilitation. So it's finding ways to cope and to live with and to recover from the long COVID. So a focus on psychological support, therapeutic support, social prescribing, and some of the issues that Paola's identified around, kind of the practical implications of long COVID, support for income, practical things that people need to get through it. The fourth tier within Liverpool then is going to be provided by LUFT, Liverpool University Hospital Foundation Trust, and they're going to be doing a medicalology, that's probably the best way I can describe it, service where cardiologists, nephrologists, anyone who seems to have maybe an underlying physical response that requires multidisciplinary care, maybe affecting a number of different organs or a number of different systems within the body. And so the team in the hospital, Royal and Aintree combined, will be offering that multidisciplinary medical support, and they'll be bringing in all the skills of the hospital team for those patients who would benefit from a tier 4. So in terms of focus on the actions, the self-care infrastructure is a national one. We're signposting and encouraging people to use that. All our practices are now participating in the National Service Specification for Long COVID data education pathways locally. Our Tier 3 service, assessment and rehabilitation, will be mobilised within the next month. We've got a partner actively making that happen. And our Tier 4 service, the complexologies, that's there, but that's going to be formalised quite a lot more over the next couple of months.
Brilliant, thanks very much. Councillor Lake, do you want to come in?
Thanks, Deputy Mayor. So there's still a lot of emergent evidence on this, and it's obviously got the potential to have a significant impact on the population both now and in the future. I think that we still need to ensure that we're being mindful and aware of the safety measures that were in place. COVID hasn't gone away despite what people might think, and I'd much rather prevention by people getting vaccinated, regular testing, wearing a face covering and social distancing, rather than somebody requiring admission to hospital for treatment. I think we need to also be mindful of the pressures that the local hospitals and the NHS generally is under at the minute, and we've currently got high occupancy levels across the local hospital trusts in Liverpool, including in the critical care units as well. And I just want to point out that the original decisions that were made by central government for the roadmap out of lockdown included a test that infection rates don't risk a surge in hospitalisations, which would put unsustainable pressure on the NHS, which is somewhere where we are approaching again, given the fact that our case numbers now are as high as they were in January, back when we were in a national lockdown. So I just think we really need to reinforce that point. This hasn't gone away, just regardless of the fact that there's been Freedom Day announced and a little bit of fatigue in regards to COVID in general. It's still not over, and we can't drop our guard now because we'll pay for it in the long run. So we just all need to keep our wits about us. Thanks.
Thanks, Councillor Lake. Sarah, do you want to come in?
Yeah, as you might expect, I've got quite a lot to say on this subject. I've spent a year dealing with pretty extreme long COVID myself, and I've got hundreds of thousands of long COVID friends, because in the outset, when it was people were saying that COVID couldn't exist beyond a few weeks, and we were noticing that our symptoms didn't improve, we almost became our own doctors. We did our own research. We were the ones. I was involved in NRH's first peer review, their lived experience. I've been involved in the research panels and a whole load of other stuff they've got on, but they've been going on. It won't surprise you that some of the key messages that I have is about communication with the public, because I probably recovered partly because I had a lot of resources and I was really able to find out the information and understand it. A lot of people are not in that situation. A lot of people are a lot less connected through internet and kind of peer resources and things like that. But also about learning from lived experience, because there's a load of really useful information in that paper, but there are some things that kind of from a lived experience, I would say, well, actually there's bits that's missing. So the symptoms list, although it's long, is not entirely comprehensive. The fatigue isn't really like normal fatigue, because so many people talk about post-exertional malaise and being completely wiped out for days later. It's not being tired while you're doing something. It's the fact that your entire week can be affected if you've maybe showered. It can be fairly extreme in terms of the cardiac symptoms, symptoms of POTS, postural orthostatic tachycardia syndrome. People's heart rate's going up even if they just sit up is really, really common. I think it's far more desperate when people experience it than any descriptions can ever be. Really good to see the plans for the improved kind of provision of GP practices, but bearing in mind the pressure that primary care is actually under, how sustainable is that actually? And also for the MDT. But I have to say there's quite a lot of negative feedback from people with long COVID about the My COVID Recovery site or Your COVID Recovery site. A lot of feedback was shared with the government and there have been some changes, but there's a lot of information that's kind of not really that helpful for people. There's lots of things that people wish people knew that have been missing. There's certainly, I'd say, there was a long COVID task group that people with long COVID were involved in nationally, but the comments they made about that site, they sometimes fell on deaf ears. But there's lots of lived experience around that we can draw on as we develop those services, and just finding out how they actually work for people in practice, because I'm probably the only person I know that was as ill as I was and is now back to full-time work and full-time activity. Most people I know from the first wave that were hit badly are still partly bedbound, still struggling to get back to work. Quite a lot of them are teachers, NHS staff. So it's the impact on their employers as well as their families and themselves.
Thanks, Sarah. Are we missing a trick there? Do people want to talk about the impact, the involvement from those facing long COVID themselves? Yep.
I think the model that we've got feels like a really good opportunity to actually bring that experience into service improvement and development, because what we haven't had up till now is a local MDT that brings in the various skills of all the professionals who've got some experience and who've started to try to work their way with patients through the long COVID experience. And, you know, when I speak to the pulmonary rehabilitation colleagues who've been seeing patients for the last 6 months, they've learned so much stuff. And so how they share that with psychology, how they share that with the medical input, how they share that with the OTs and the physios, the social prescribers, is really important. So we bring that experience and that feedback into the developing model. So I think, you know, absolutely accept you know, kind of there's so many people on the internet with so many valid, really important experiences. It's how we translate that into meaningful face-to-face and virtual and service offers. And I really kind of think the MDT is our first step to doing that, because we're bringing together people who've got a focus on long COVID and who can, and, you know, part of the job is to sit down, bring patients into that MDT where that would work for the patient. Okay. And actually share that knowledge and experience, build it up, because I don't think any teams currently got that as a whole team, and that's what we need to bring in order that we help to cross-fertilise and support patients through different pathways.
And Michelle, who would make that decision? Can we leave that with you to action and talk to Sarah, so there is a way in for those with lived experience to be listened to and involved in looking at the ways forward?
Absolutely, yeah.
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 Is that an action really that we can, helpful. There we go, Peter, we've got an action after the Liverpool Health and Wellbeing Board made up. Go on, Michelle, sorry.
Can I just make a comment as well? Like, the jury's out about case finding. We think there should be some active case finding. Others say we don't know what the evidence is. And so we are very, very keen to see how the MDT can support, you know, for your point about not everyone can navigate the system and has access to the internet and stuff. So a bit of proactive case finding. We're certainly going to be testing that as we develop the model and see how it goes.
Ben, are you involved in any of the research, or any of your guys?
Yes, a couple of questions, if I could. And they're questions I know there's no definitive answer to, but I'm not trying to catch people out, because although we think COVID's been going on forever, because we can't, it's affected our lives. In fact, it hasn't been going on forever because we don't know what the long-term results are going to be. So the last figures I got on long-term COVID were early summer, that if I remember rightly, about 600,000 had COVID symptoms for at least 3 months and 300,000 for a year, but we're now 16 months on. How many of those are still getting it? And is anyone beginning to find enough data to suggest that some of these, it might be 3 years or 5 years, and how severe might it be, and particularly in the context of young people who are going back to schools, which I don't think in many cases are particularly safe. And the second question is a similar one, which I'm not trying to catch anyone out on, but we've talked about long COVID, but the other side of this is permanent damage to organs in the body. And I know we might find that out in 10 years' time with some people, but I think it's important that we get information like this out to those that say, oh, only 100 people are dying a day, but there might be 1,000 people badly affected, and to perhaps get information out to some people who don't think this exists at all. So what information is there about that in Liverpool so that we can start to quantify it and say, we're probably going to be looking after 5,000 people for the next 3 years, or whatever it is. How are we going to try and approach that global figure?
Yeah, thank you, Councillor Kemp. Anybody want to come in response to that?
I will.
Yeah. Sorry, Paula?
Shall I try to respond, or?
Yep.
All right. The answer is there are ongoing studies developed by the University of Oxford, University of Cambridge. We don't, to my knowledge, Ben will know more. We don't have a local trial looking at long COVID in Liverpool. So the paper that I summarized used methodology developed by other university and just applied those kind of estimations to our local population. So we do not have an exact number of people who had or have long COVID. We also don't know exactly how many had permanent organ damage, but everything that is in the paper is based on using methodologies from ongoing studies. So it's an emerging condition, it's an emerging definition. The definition itself is sometimes difficult to apply because it has signs and symptoms from many other chronic conditions, and sometimes is a diagnosis of exclusion. So that's the problem we are facing. It's not very easy to diagnose people, and it's not very easy to run a trial. Also, there are many people who do not present to services even if they have signs and symptoms of long COVID. Therefore, what we need to do is to look at the numbers we've estimated and then at the numbers actually recorded by services and try to find the people who might have long COVID, but we don't know about. So kind of finding the missing thousands of people who might struggle and might need our help. I don't know if that's answering the question. I can look into specific studies.
Okay. Ben, do you want to come in as our researcher link with Health and Wellbeing Board?
Yeah, I mean, I believe people at the University of Liverpool are involved in some of the national studies on long COVID. It's not an area that I particularly have any particular knowledge about. But as everyone has already said, it's a sort of rapidly changing field. And yeah, the research will be kind of emerging as and when, and we'll be feeding it into the design of services as it emerges. I would also sort of second the point that you made, Chair. It's really crucial that we get the experience, the lived experience of people with long COVID from our local population involved in the service design.
So is it worth, sorry, we'll finish now, but is it worth actually drawing something up around research with those with lived experience to feed in from Liverpool that we can match it? What do you think?
I think that's a good idea, Chair, absolutely.
Yeah, so the voice of the people most affected is fed into the national picture, but it's also fed in locally so that we can respond locally. Sarah, you up with that?
Matt intervened. I think it's very important then that Matt and the comms team start getting that messaging out locally that it isn't just deaths and hospitalisations. So the more we can raise people's awareness, the
good
better.
point. Yeah, good point. And also for children.
Chair, I'll take that as an action on the
Yeah.
back of today's report.
Lovely. And the link with the ages as well, with the children in schools, because this is it could well affect them and their life chances, which goes back into the Marmot stuff. Okay, lovely. So there's some good actions out
Can I just add one point on the children thing?
Sorry, Sarah.
There is some very recent findings out that young children are less affected than expected. There's a clock study, it's one of the NIHR funded studies, so we definitely need to reference that. We don't want to scare parents too much.
No.
I do know children who have long COVID, but the numbers seem to be much lower than among adults.
Great.
So
okay.
it's really important to get that message toned right.
Okay, so I'll repeat that. So it's very low numbers for children being affected.
Relatively low.
Relatively low. But the key thing is that we get the lived experience, that information from yourselves.
I mean, obviously, if there's a huge volume of children affected by COVID, even a small proportion is a significant number of children then getting long COVID. But it just not wanting to oversell that message.
Absolutely. Okay, and the Liverpool voice of Liverpool people in the Liverpool response is crucial. Okay, lovely. Thank you. Okay, so we're moving on from that one to still COVID, unfortunately. Life expectancy. Paula, again, do you want to introduce this one? And this has got a link up with the Marmot team as well in implementing a recovery plan. So life expectancy, pages 32 to 39. Thanks, Paula.
Yes, thank you. So a very brief introduction. As you know, nationally, the life expectancy has fallen during the pandemic to the level of a decade ago. We presented previously to the board a situation in Liverpool. The life expectancy decreased by 2.4 years in 2020 after being at the highest level in 2019. This is for Liverpool. Sadly, this decrease has continued into the first 4 months of 2021. We try to look into the paper at how this varies by deprivation. We know that all areas of Liverpool have seen a reduction in life expectancy between 2019 and 2020, but our most deprived communities have been hit hardest. So now the life expectancy in our most deprived quintile is 73.5 years, but the life expectancy gap with the least deprived parts of the city remains at 8.8 years. To note, the quintiles 2 and 3 have seen the largest reduction in life expectancy of 3 and 3.3 years respectively. Which basically brings a widening of the life expectancy gap between these communities and the least deprived quintile of our population. We also know that there have been more than 1,000 Liverpool deaths from COVID and more than 2/3 of these deaths have been in people over the age of 75. What we need to understand is what contributed to the drop in life expectancy. We haven't done this work for Liverpool, or unless the university colleagues are working on something. But we know that the Marmot team working with the Greater Manchester system confirmed in their work that the life expectancy in the Northwest also declined during 2020 and more in the Northwest compared to England overall. So we want to undertake a similar process for Liverpool, as Gavin explained before, to use the work of the Marmot team to understand what are the specific factors that contribute to the drop in life expectancy in Liverpool, and then to produce recovery plans from that work. So we are asking the board to support this work, and that will identify what factors contribute to the life expectancy drop in Liverpool, and then to support the recovery plans that will be produced as part of this.
Thank you, Paula. Councillor Lake, do you want to come in?
Yeah, thank you, Deputy Mayor. Yeah, so just in regards to this, the decrease in life expectancy is obviously worrying for the city, and we need to make sure that we're all working together strongly in the system to rectify the situation as quickly as possible, and to ensure that everyone's got the best chance in life, but at the same time putting measures in place to prevent ill health developing. And I think we need to make sure that people get the care and support that they need, regardless of whether it's physical or mental support. Thank you.
Thank you. Yep, Matt, do you want to come in?
Thank you, Chair. I mean, I think it's just worth noting this is a significant and unprecedented drop in life expectancy. It is very concerning for us in the city, and we absolutely need to commit as partners to work together to, as Paola's outlined, understand exactly the reasons behind that drop in life expectancy, apart from the more general pandemic, and putting measures in place to address them. This is our opportunity, I would suggest, as a city to properly start dealing with the inequalities that exist, and I don't think we should waste that opportunity, Chair.
Okay, anybody else want to make a comment on that? We need to push back very, very hard, and I think the way to push back on the government is actually through the evidence, and we've got the evidence there. And if you're overlaying that with real people's voices in there, in the middle of that, so I represent Everton, which is the most disadvantaged ward in the city. So these are my mates, so it's very, very close to my heart. So I think if we can pull this together and use the evidence cleverly. Ben, I'm looking at you as well on the research side with the universities, because obviously when things get into the BMJ, that holds a lot of weight. People sit up and listen. And when we're pulling it together as we're looking at those 6 outcomes with Fair Society, Healthy Lives, again, it doesn't take much to get Michael Marmot on Newsnight. Or rather, he loves being on Newsnight, but we love him being on Newsnight because it focuses in on actually people's lives. So I think it would be useful to use this in a clever way rather than just having it here. We actually use it well. Again, Gavin, it might be something that we could look at in the workshop because that drop and that in life expectancy is appalling. And you overlay that on all the stuff that's coming through and it's immoral and unjust. Okay, so we're agreeing the recommendations set out in the report. Lovely, and we'll pick up those actions. Fabulous. All right, we're on to Child Friendly City. We're just gone 2 o'clock, so we're an hour in. Again, Child Friendly City, really, really important. Steve, are you going to, and is Alison here or just yourself? Just yourself, lovely, okay.
Thank you very much, Chair. And Peter, you're right with, have you got the slide clicker thing?
Yeah. Did he put it in his pocket? Bernie, come back in. You've got the clicker.
Nice one.
There you go, Steve. Saved by the clicker.
That way or that way?
I think over where does Steve point it? Bottom of where? Yep. You got it there? Where's he meant to be pointing it?
I only wish the slides were worth the wait. Yes. Child friendly.
Which will do his magic. So this is pages 40 to 42. Do you want to just give us a bit of a verbal on the backdrop to Child Friendly City?
Yeah, so there is a very short briefing document that you've got in your pack there, which Alison Moglione prepared, which is very succinct and clear, and is a really good summary of where we're up to. And to be frank, looking around the room, I know I'm preaching to the converted, so I will go through this quite quickly. But I guess the things to emphasise, this is all about a children's rights-based approach to everything we do in the city. The key thing is about the voice of children and listening to them, not just consulting them, but listening to them and being led by them. I have to say we've got fantastic support across the city from partners, and we are building on some good practice, but that there's always work to do in terms of trying to put young people in the driving seat. And I guess, which will touch on the next item, some of the metrics in the city are in the wrong direction, and are not child friendly in terms of the definition. I'll try and, there we go. So the formal programme supported by UNICEF, is in these places across the UK. Other places are looking to join, and we've already had quite a few cities contact us and ask us, how we've benefited from the programme and what it really means. And we'll circulate the slides, but again, the 7 principles of a children's rights-based approach are there on the slide. We'll circulate them, but I just wanted to flag up, we've already got, for instance, some schools in the city which have developed a children's rights-based approach based on this model, which we can celebrate, which is really good. The programme itself, then, the phases of it, is laid out on the slide there in terms of discovery, development, delivery, and then recognition. The COVID response and our desire to engage as many young people from diverse places as possible has slowed us down. And we just think it's really important that we take our time and reach out to lots of different young people's groups. And we still haven't finished that. There are still groups of young people that we know don't have a voice, and we want to try and link with them as much as possible. So that is how the programme runs, and we're currently in the sort of developing the action plan phase, and then working with young people before we start that delivery phase. UNICEF talk about badges, but I call them priorities. So all these things are the sort of the areas of priority you can work in, and UNICEF asks you to focus on the 3 basic priorities around culture, communication, cooperation, and leadership. And then it's for the young people in your area to choose the things that they think are the most important, which I'll come on to in a second. So you have 6 priorities effectively to work through. This is a slide just lists all the organisations that are supporting this and are part of the governance group. But beyond that, we have lots of other people who are really positive and supportive about this agenda. So again, just a massive thank you to people in this room and lots of organisations that aren't in the room that are supporting this. And as I said, already got some great good practice in place, but people really wanting to do more and get more for young people in the city and be recognised. In terms of young people, then these are a selection of some of the groups that we're working with through schools Parliament. We've got a young inspectors group, different organisations. We've had a couple of big surveys, lots and lots of focus groups, and as you can imagine, we take a lot of time talking to young people about them setting up the focus groups and making it child friendly and making it in a child friendly place as well. So I've had some great contributions from our young people. Developed a vision, which again I think I'm preaching to the converted here. Aspirations, all our children, young people, wherever they are in the city, wherever they come from, enjoy the best possible quality of life. Critically for this programme, have a say in matters that affect them and are able to reach their full potential. So locally then, we spent a long time with young people about the priorities. So as well as those 3 basic ones that UNICEF asked you to focus on, locally young people chose place. So the sort of environmental stuff and making sure it's a safe place and it's a child-friendly place. Healthy and particularly focused on mental health was an issue for a lot of young people, and then equal and included. So again, we spend a lot of time with lots of different groups of young people to arrive at that priority. And then just some of the comments from some of the young people when we talked about the action planning and what they wanted to see. So just pick one as an example. Under culture, they wanted to teach social skills, including how to speak to adults and children with mutual respect. And that's about how we work together and respect each other and critically respect children's rights. And again, I won't go through this because of time, but the group that's focused on equal and included, we asked them to go through, what does that look like for them? So, they talked about their more awareness training for teaching staff as an example, about ensure young people's needs are considered and supported, how we tackle hate crime in schools, and how we make events and things like that more child friendly, which again, there's good examples in the city, but we can always do more. Just to flagging up during COVID, some of the things we had what I thought was a really good session with city leaders and young people, and they said, well, actually, it was a bit boring and formal and structured, and that's what it's about. It's about listening to young people, and they then ran the next session and led it and compared it, and that they really got more out of that, and it's one of those things that you learn as you go through. But there've been real good engagement during COVID, but I think we're all pretty fatigued through the virtual meetings at the minute, so we're trying to meet more young people physically. I've had a couple of good events, some really good work with young people as well, sort of doing play and activity events and talking to them while they're doing that. So some of the next steps then, we're specifically doing some early years participation work, because critically it'd be very easy, wouldn't it, to sort of not engage with very young children about what they think about the city and what's important to them. So we're doing some specific work there. Ongoing work through the governance group and with partners about the priorities and changes. So as we develop the action plans, that we're also looking for quick wins and things that we could do that would ensure young people knew we were serious about this programme. And we've got a lot of action planning workshops with the partners and the young people to shape up those action plans. In terms of the 6 priority areas, this slide just tells you which particular organisations and groups are involved in sort of leading those along with the young people, which so for instance at the bottom there on the equal and included priority, we've got the Young People's Advisory Service, we've got Special Schools Association, Specific School and LivePack as well engaged in that. Here's just for more information, some of the contact information, and in the note that's been provided there is some highlights there for you to read at your leisure. There's a lot of training we've been doing with UNICEF across the city. What I think I've been asked to really stress is that, again, a lot of those people are already engaged with young people, and you know what would be a really good indication for the city if those who directly don't work with children and young people, if more of those individuals were getting involved in the training. And what you find is people say to you, oh, can I just have the lunchtime half-an-hour session? So you do that, and then they say, right, we now need all our staff to go on the half-day session, because people get really enthused about it. So really positive support, real great engagement from young people, and great support from UNICEF. My final point, though, is, so this is the Child Friendly City programme. We have to ask ourselves, when we've heard about some of the stuff on the agenda already today, some of that's fighting against us creating a child-friendly city, families in poverty, and so on. Reduced opportunities for people because of funding, etc. All of that stuff is counter to what the young people are telling us they want to see. Thank you.
Thanks, Steve. There's a lot to think about there. If you want to comment with questions or comments, I think you go on, Sarah.
It's just a fun. We've got 2 young people focused, well, the job share workers, but their focus is on engaging health young people around health and their feedback and experiences, and they're usually enthusiastic about this. They're part of the Participation Workers Forum, and they've been doing some work with Alder Hay, trying to put some project in place there about young people's their choice and their rights around healthcare. So I think there's so much potential with this, but I do share your concern that the kind of the climate we're in makes it really so much more challenging than it would have been. We know that Liverpool is facing massive challenges, and young people probably bear the weight of that more than the rest of us. So it's quite hard to get people as enthused and dynamic when at the same time we know that there's cuts, there's kind of reduced life expectancies, reduced opportunities for so many people. But there's kind of one thing that I come back to when I'm a little bit, if I get a little bit cynical about involving young people, and it's remembering a conversation I had with a family in Alder Hay, and they were on the cancer ward, and the kid was about 2 years old and ran off to play with other various of the kids. But the mum told me that from his very first appointment on that cancer ward, when he was only a baby, the specialist addressed every single question to him. Fair enough, there were a lot that the mum had to answer, but from the very start, he was the key person in that process. And she says, as a result, despite the fact he was going there for chemo, which was a traumatic experience for anybody, he looked forward to it. Every time they drove past the hospital, he wanted to know if he could go in there then, because he felt so special. So if you can engage a kid with a really difficult life experiences from such a young age, there's no reason why we can't get children involved in all the decisions that affect their lives.
Brilliant. And Steve, do you want to come back on that?
I was say that's a really good point. One of the issues around the sort of equal and included priority you have to recognise is that the parents and children don't always agree on what's good for them. So we have to talk to both.
Absolutely. But this is a child-friendly city, so we focus on the children. So you'll have to wait, parent carer. Hang on a minute. I did a little. So we got these 3 questions out. So our survey on our city, our future, your say, with the 3 big open questions of what do you love about our city, what would you love to see in our city, what would make our city stronger and fairer, and they're deliberately open questions. This isn't about council and budget. However, if there's interesting stuff in there, great, we'll grab it with both hands and say, now that could link. I'm really keen, Steve, that children get involved with this, children and young people. You can do it on your, what's it called, Fraser? Your QR code. Sorry, I'll get there eventually. I did it with a little one of 7 with her mother, but she was the voice. She was the voice, and I did it on my phone. We sent it in, and it's dead easy to do. So please, that we're focusing in until the end of the first week of October. So GPs practices, get them out there. They're so good, and then we'll see what happens. But I'll give you them afterwards, and we've got them on the council website as well through Liverpool Express. Anybody, anywhere. And one particular group I'm working with, they're going to do it with their children who are quite severely disabled, that they know really well. So they'll do it alongside of them. So the more children's voices and young people's voices we get out there, the better. Lovely. Thanks very much. And the last question I had, Steve, was, do we have people named as champions within organisations that whatever level of the organisation they are, they actually get listened to? They can say, hang on a minute, what's the child's voice in this? And if not, can we?
Well, I think we've got the members of the governance group, but at this stage, as I've said a couple of times, it tends to be the people are really passionate about this, and I think that's what our next phase of this, in terms of how are you changing the culture. Then it's not always those directly involved with children who stop and ask the question. But I mean, what I would say is particularly, and not just because he's here, but Councillor Lake and also Councillor Logan and the Mayor from day one have said this is important.
Yeah, absolutely.
And that's really encouraging. And even in this building, when the city plan, I can see Councillor Kemp's got the city plan there. When the city plan was being launched, we got some young people to talk about the city and what's important. And I think that, we've got a lot to be proud of in our young people. They're bright and intelligent, and they have some great ideas, and we just need to make sure the city is good enough for them.
Yeah, and it links back into proportionate universalism as well, because there's, in the most disadvantaged areas, quite often they were dependent on really good youth services, which have almost gone, but they haven't, but they're hanging on in there, and also the balance. David, it's either you or David that comes to the meeting, would always go on about the balance of how much we're spending on children versus how much we're spending on adults. So that's something that we're going to be looking at in the budget. Councillor Lake, isn't it? To just look at both of those things. Okay, thanks, Steve, for that. So the update's worth noting. Definitely. Thank you very much. Okay, very quickly moving on then, and this again fits in with this whole theme, so it's good to have children at the centre of this particular meeting. It's the Safeguarding Children's Partnership report. Steve, again, isn't it? Page 43.
Thank you. I'll be really brief, but this is part of the governance of this meeting, because the Children's Safeguarding Board annual report, and indeed the adults, needs to come to this meeting, and so you're aware of it. I think I'd stress some of the positives, and you'll see in the report we've adopted the signs of safety strength-based model. So we talk about what's going well, what we're worried about, and what we're going to do about it. You'll see that sort of model in the report. But there's some real positives in the report, in terms of we've had an independent piece of scrutiny done by an independent person to look at our arrangements and look how we're tackling safeguarding issues in the city. And you'll see in the annual report that person's given us some really positive feedback about our arrangements. We've continued to have really positive engagement. Over 35 agencies across the city are supporting the Safeguarding Board Forum and the subgroups, which is really positive. The Safeguarding Board and the agencies involved and others, like most agencies in the city, have continued to develop the plans and actions against priorities, even during the pandemic, which has obviously provided so many additional challenges around safeguarding as well. But there are obviously some things that we're concerned about, and in terms of reviewing our priorities as a safeguarding partnership this year, we're particularly going to focus on neglect, domestic abuse, child exploitation, and we're particularly looking around education, at school attendance, and children missing education, are areas we're going to really focus on. And I think since this report was put together, so some other things I think we can add to that. So the sexual harassment and assault, that some of the issues that young people, particularly young girls and women, have flagged up, which has come out in consultation with schools, and also young people's mental health is a significant concern, which you'll see we're going to present to the next Health and Social Care Select Committee as well in the next week or so. The other thing positive I wanted to flag up again in terms of the theme of listening to our young people, we've got our group of young advisors, and they've done a one-page excellent version. Some might say it's even better than the actual report itself, but really want to thank our young people for doing their one-page version of it. One of the other big themes you'll see coming through, which does link again to the rest of the agenda, is in terms of the demand for social care, early help and social care. We're really seeing high levels of neglect. And we would all say on this committee that, neglect isn't always linked to poverty. And, just because a family, is challenged around poverty and etc., doesn't mean, there's intervention in terms of early help and social care. But we are seeing that in terms of presentations to social care, neglect, stresses in family linked to adult mental health, domestic abuse, substance misuse. These are all things that are driving demand, and you'll see that. You'll see that in the report. So what I would say in summary is, in terms of our arrangements, we've had some independent scrutiny of that, and our arrangements are good. We've got really good engagement across the partnership in terms of managing children's safeguarding in Liverpool. But the threats and risks are significant, and again, during COVID, some of those have increased. Thank you.
Okay, any comments? Okay, couple from me quickly. System neglect. We just looked at child poverty in terms of food, access to the family income. So if we can keep an eye on that, because I think I've been challenging the definition of neglect as in safeguarding for quite a long time now. So it'd be good if you could just feed us in with the latest definition, perhaps at the next meeting, actually, we could just double check that, because poverty is not neglect, as you said. The other one is trauma-informed social work. So I don't know whether we could feed back, and have you got anything to respond on that one?
Yeah, I think there's two things to link into that. First of all, you'll see in terms of some of the good news this year, we actually won some national awards for the work we've done with the Graded Care 2 profile, which is the neglect assessment tool, which takes a trauma-informed approach. You'll see also in the report the work that's been done on adverse childhood experiences, which is obviously that big focus on trauma-informed. In terms of working in partnership across the city region, actually we've just launched some work with PAUSE, which is work with women who've had multiple removals of children, and at the heart of that is how you build relationships with women and who've experienced that and understand the trauma they've been through. So there's a lot of work around that, and also our wider rollout of the signs of safety approach, which is at its heart trauma-informed and strength-based practice as well. But I could certainly provide a more detailed update outside of that.
And the last one is child exploitation. You're presumably linking that up with county lines specifically, and keeping an eye on the situation in Afghanistan, where probably the Taliban will now depend on the money from the poppy fields, which will mean that Liverpool could well get flooded with very cheap heroin. And given that the cannabis has been laced with heroin in the past, they will hook people in, and the children will then be used to run it. So it will be really useful to see what happens at that. I think it's December, is it, the next one? If there's anything that we just pick up from under matters arising, not big reports, just to keep a really close eye on it, because again, as things start to unravel even more than they have unravelled, children are often the ones that are used and abused within that by those that want to make a massive amount of money.
Absolutely. And we are supported hugely by Merseyside Police, and they've got a bespoke team, obviously on county lines and child criminal exploitation. If we could just finish with one plug, really, which is there's a whole plethora of early help work and preventative work going on around reducing numbers of looked after children. But next month we're going to develop a partnership workshop to talk about what more we can do as a partnership, because as we said, there's a big child focus here, but it's really the family. What can we do more as a city to support families in crisis, be that through housing, poverty issues, employment, as I said, mental health, drug abuse, domestic abuse, supporting families. There's a massive return on investment to do that, as well as, you know, the obvious ethical, moral argument that we shouldn't have as many children looked after in Liverpool, should we?
Okay.
Thanks
very much. Go on, Ben. Yeah.
So I just wanted to pick up on the issue around sort of prevention and early help. I mean, one of the things that we've seen across the country over the last decade really has been a reduction in funding for early years prevention, and alongside that, an increase in expenditure on safeguarding. And you know, what we need to be trying to do is to shift that back the other way, so that we're increasing the investment in prevention. But obviously, if we're spending all the money on safeguarding, it's a lot harder to then invest in the prevention. So to be able to track that within the budgets to see if we can start monitoring and shifting that investment, as well as the overall share of investment that's going to children, I think is crucial.
Thanks, Ben. And the problem for us, obviously, is, and other people, is that we have a statutory duty to respond, which the money gets cut, which then means you have to cover your back on the statutory, which then impacts massively on the intervention, early help and prevention. Absolutely. So the more that gets in the BMJ that screams from the rooftops, the better. Nice clear diagrams. This is what's actually happening. Seriously, it will be really helpful, because we need all the help we can get together collectively. Lovely. Okay, so that's that one agreed and recommended. Yeah, we okay with that? Yep. Lovely. Thank you. And then we're on to 11. We're nearly there now. Okay, so we're on to pages 73 to 87. And Jan, you're going to speak to this one.
Yeah, thank you, Chair. I don't intend going through the paper in detail. It's based on the reforms that are currently going through Parliament for approval to form new legislation to create what we call integrated care partnerships at Cheshire and Mersey level, and these are being done across the country. It will mean that the CCG is abolished from the 1st of April next year, and our functions will transfer to the new integrated care partnership through a new NHS board at Cheshire and Mersey level. The work we've been doing that's contained in this report is to really strengthen the place-based partnerships between the health system, social care, our voluntary sector and our other partners in Liverpool, to ensure that from a place perspective, we are mature enough as a partnership to receive delegation from the integrated care system at Cheshire and Mersey level, those areas that we want to retain control of locally in order to make a difference to a lot of what we've discussed this morning, or this afternoon, sorry. So what we're asking the board to do is note the changes that are being proposed from the Health and Social Care Act, establish and support the development and the change from an integrated care partnership board to a One Liverpool partnership board, reflecting on the strategy that we've agreed as partners already in the Health and Wellbeing Board here, to reflect the priorities that we've identified through the One Liverpool Partnership Board, of which complex lives is one piece of work that we want to significantly prioritise, which will take into account Steve's point about those most vulnerable families in our communities locally, and learn how we can use a population health approach to delivering services as we go forward. And the Health and Wellbeing Board has to recognise those changes. I don't propose to go through it any further. I think probably questions will be more important than what's written there. Thank you.
Thanks, Jan. Councillor Lake.
Thank you, Deputy Mayor. Yeah, in regards to this, I know that there's been a lot of concerns in regards to the ICS in general. Yeah. So prior to the meeting, I've circulated around the Red Lines document, which has been signed by either council leaders or representatives from each council with portfolio responsibility for health. And that's just detailing a little bit more of actually the involvement that local authorities need to play a part in this, and a sort of set of minimum standards that we want to be able to ensure that we're playing an active role within this. And I think that's I think overall it's been well received, to be fair, and I don't think there's any disagreement on that from a local perspective. I think it just needs to be fed in about the fact, when we're talking about place-based approach and things like that, that is absolutely crucial, and having a blanket rule approach isn't something that's not going to work, and what might work somewhere might not work here, and vice versa. It doesn't always work like that. So I think that's crucial. I know that it was supported by Steve Warburton, who is the obviously outgoing chief executive of the Foundation Trust, but given his new role in a strategic leadership role within the ICS, I think we want to make sure that that support's continued as well, and his backing on this is something that's continued throughout that, because that's going to be the best outcomes for the people of Liverpool. Thank you.
Thank you, Councillor Lake. Anybody else, Richard? Councillor Kemp, sorry.
Richard is fine. Basically, I'm grateful for this paper that Fraser circulated, which I know is gets support across local government from all over the country. Very similar things are being done. But there are still some basic questions that either I don't understand or perhaps haven't been answered yet. It seems to me that we'll be looking at health at 5 different levels now. One of them's almost irrelevant, and that's what happens across the STP ICS area itself. Frankly, I don't give a damn what's happening in Macclesfield, and they don't give a damn what's happening here. So if we leave then the Liverpool City region, which is the half of it, we've got to be doing some things at the city region. We've got to be doing some things at a sub-city region, but bigger than Liverpool. When I think of public health, if we're doing public health messaging, we do it through the Echo or Radio Merseyside. Are we going to send out 3 lots of information, or is Matt going to work with his opposite number, I think it is, to get those messages out? So what's the Liverpool City region, the sub-city region? What do we do at the city? And then what do we do at the level below, which we talked about before with PCNs and that element of joining up. So I'm not quite sure how that's going to work unless the new body also accepts we've got to work at 5 different levels. And then that leads to the other question of who we're going to relate to, particularly at the Health and Wellbeing Board, because I think we all accept that at the city level, it's the Health and Wellbeing Board where all these organisations should come together. Are you going to be here? And who's going to decide whether it's you or Fiona or the lady that's gone before? Are we going to get someone from Macclesfield to come and talk to us about what's needing doing? So, yeah, God forbid, I think you said that. Yeah. You don't even know where Macclesfield is, do you? You're a foreigner.
I'm sure Fiona does.
It's a long way away. So
we love Macclesfield.
Sorry,
we love Macclesfield.
We love Macclesfield. We do. We love Macclesfield. Wherever it is, we like it. But how do we ensure that as Liverpool City Councillors, we are going to be meeting the people we need to meet? Because I don't understand where the decisions about that will be yet. Now, perhaps no one knows at the moment, but I think adding to the paper that Fraser did, that we ought to be looking at their structure to make sure it matches the structures that we need to make work. Not the big structure, the substructures that will really mean the difference between success and failure.
Go on, Matt.
Thank you, Chair. I'm probably going to make a point about the local arrangements and the relationship with the Health and Wellbeing Board, and I absolutely welcome the page 77, which outlines the key functions of the new board. I was just thinking we might have an opportunity, because it reports into the Health and Wellbeing Board or reports progress to the Health and Wellbeing Board, to reinforce some of the wider Health and Wellbeing Board priorities, such as some of the ones that have been on the agenda today. So what's the new board's role in contributing towards child-friendly cities or Marmot or the reduction in life expectancy? So I think we might need to put an additional function on that list, if that makes sense. It's probably captured within the One Liverpool plan, but it's not on here, just to make that clearer, Jan.
Yeah, I agree, and I think it's more about, we've agreed a citywide health and care strategy, how do all the other elements fit in with delivery of that strategy? So, children and complex lives, children and frailty, children and disability. The population health approach we've taken doesn't exclude any age, any person, any individual. It's more about how we learn to work differently together, is the important feature here. We can prevent a lot of those issues. Marmot is written right through. It may not have Marmot written in it, but actually driving those outcomes and reducing those inequalities is everything that we've said before. So I think it does run right the way through. Matt, I think you're right in terms of reflecting on elements that we've already agreed that need to feature in here. But this isn't about duplication. This is about simplifying the way we work in order to drive those greater reductions in inequality and outcome.
Okay, thanks.
Could I come back to Richard's point? From an ICS perspective, I don't know whether I'll be here. There will be a HR framework and process that we have to go through. For all CCG staff, there is an employment guarantee other than those of us at board level. So those people that do work in the CCG currently will transfer into the ICS. I don't think from day one their role and their place of work will change. It may do over time, but not initially. There will be a process to go through to appoint to the NHS body that will be at Cheshire and Mersey level. They have recently gone through the appointment for the chair role. Secretary of State makes those appointments and they will be announced in early October. The chief executive post is out to advert now. The NHS body will appoint, and it could be jointly with partners in place, an NHS body, NHS person that will be given the responsibility for that delegated budget to place. And there are a number of options of the working relationships between the place-based arrangement and the integrated care partnership at Cheshire and Mersey level. But there's a lot of that we've got to work through. But I agree with you, there will be things that we need to agree for Liverpool. There'll be things we need to agree for North Mersey. There'll be things we need to agree for Merseyside, and there'll be things that were addressed at Cheshire and Merseyside level. So I think those 5 levels are recognised.
Okay. I'm going to bring Councillor Lakin again, just about timelines and government and where we're up to and all of that. I'm just wondering, Jan, if actually we need to make sure here that any change in governance comes to this board to be agreed or not, as the case may be, so that we've got that direct link with the Health and Wellbeing Board. Is that acceptable?
I think certainly how we work locally, we have obviously the authority to agree. How the NHS body works will be determined by the NHS guidance that has yet to be published, and it is dependent on the bill's trip through Parliament.
Yeah, but if you're happy with that, then we can work through together collectively and keep a really, really close eye on it. Fraser, you want to come in?
Yeah, just in regards to the comments made by Richard, I completely agree as well. I think that the substructures are something that needs to be focused on and looked at. I think there's a lot, because we're still going through the parliamentary process at the minute, there's a lot that needs unravelling within that, and actually how we take that out and we bring it to life sort of thing and across the Cheshire and Merseyside area, and then break it down into each subgroup. So obviously by April next year is when the CCGs are going to be merging into the ICS function, so it'll happen at that point. But that again, that seems to be on track at the moment, but depends on what happens within the parliamentary side. We don't know, that it's quite unpredictable, which I can't say shocks me with this government, but we'll see where that ends up. But I agree with the point that Richard made, and when we have something brought back to us at a more local level, we can pick that up then and make sure how we interpret that data and share it across on a different level. Thank you.
Yeah, because I think it would be useful. Go on, Sarah.
Yeah, from a public point of view, I think most of the public don't understand the NHS structures even now, and are even less likely to in future. But I think that those who do, the more people who knew, the more concerned they would be about the move of decision making to a wider footprint. And I think the general public would definitely endorse the primacy of place approach. If we could all explain what it means, the entire idea of a system in place makes no sense when I try to explain it to anybody. For the One Liverpool Partnership Board, we know the agenda, even just within Liverpool now, challenges are massive. So I do agree that the structures behind that are going to be really important. The board itself can't achieve anything. I would put a special plea in that engagement and kind of the public accountability is key to that, because we're not included as Health Watch on the proposed structure for the partnership board. We don't need to be on every committee, but we do need to have roots in. And at the moment, I've got nothing that I could tell the public that would show them that their voices are going to be heard on that.
Okay, I mean, that's absolutely crucial. Going back to, what is this whole system for? It's to serve the people in society, not to run whole structures and privatise it so others can come in and take a profit and run away with it. Thank you very much. And nor is it about sharing data and selling data for the benefit of others that want to have to profit out of it. So I think that there's quite a lot there actually, and I think what will be really useful is in terms of, if you can, Councillor Legge, if you can let us know very quickly, as soon as you know anything about that timeline where it's moving with the ping pong back in with Parliament, I think it would be a really useful exercise to have at the, let's have a think, if it's April, if it looks like it's moving quite quickly by December, then it would be useful to have it as a very clear item on this agenda, on the next meeting's agenda, Peter, and just have the other items more information rather than coming in, adding in your bits and pieces, so we can focus on that. And I think the red lines is really helpful, and then whether we need to add into those is a good question in terms of foundational principles. So focusing on purpose-led organisations and businesses, not profit-led organisations and businesses. And if we lay that down and we say that's our approach, and we all agree collectively on that, and we push back on that, it is going to happen, unless obviously suddenly, either there's a change of government or there's a complete change of heart. I can't see the change of heart necessarily. Go on, Jan.
I think we need to be careful about language, because all our GPs are independent businesses.
Yes, it's true.
And absolutely, and they are crucial partners to how we deliver care. So I think it's just, I would, want a little bit of caution about how we use that.
So they are purpose-led. So purpose-led operates true to a purpose that serves society, big tick, respects the dignity of people, big tick, and so generates a fair return for any responsible investor. Exactly. So that's what I mean by purpose-driven. That's what it's about. Yeah. And if we can get those foundational principles in there, if we focus in then for the next meeting, if possible, on this, to see how it's, to see what's happening, but also to shape it and influence it. So we've got our own principles, our foundational principles set in there, and work that through. So many people, including myself, think that this is a negative. However, we can turn a negative into a positive. And that's what we're here to try and do. Yeah. Yeah. And so we could just step back and say, I'm sorry, we're going to fight this and spend all our energy doing that. That's a waste of time. We can do that. We can make a statement, but in the meantime, we make something negative into a real positive, and have it as a great example and work together, because there's a lot of really good people in Liverpool that want to make this work, and wider in the region. Okay, lovely. We're nearly there. Anyway, sorry, recommendations agreed with that caveat, that governance changes come back to this board, and we look at that. Richard, did you say? Yeah, you're okay with that. Lovely. Okay, and then we're on to 12, pharmaceutical needs assessment timeline. This is page 88 to 91. So there's been loads of changes since the PNA was published in 18. Lots of pharmacies either closing or consolidating, and the role of pharmacies in the COVID-19 testing vaccination rollout, changes in footfall due to people working or studying at home, vital that the issues and others are taken into account by the PNA steering group, and to meet the needs again of our communities, so we don't find that areas of the city are left without access, which would be terrifying. Who's speaking to this one? Paola, you're speaking to this one again, just quickly.
Yeah, so thank you. As we know, the pharmaceutical needs assessment is a statutory document that assesses the pharmacy needs in the local population. This includes dispensing dispensing services, but as well as public health services, as you emphasize, so vaccination and other kind of public health advice. This process, so the current P&A expired in April 2021, but because of the pandemic, the process of reviewing it was suspended. It will now restart, and the new deadline for publication is October 2022. So the paper presents the timelines for producing the new P&A, with the aim to bring the first draft to the board in April 2022, then go through a 60 days consultation, and then have the final draft in October 2022. We are asking the board to support this process, but we are also asking partners organizations to release key staff members who can help with this and who can participate in the steering group that will oversee the publication of the new pharmaceutical needs assessment.
Okay.
Thank you.
Thanks, Paula. Okay, and we'll bring that back in, Richard. Yeah, do you want to make a comment on that one?
Yes, I think it's important that we develop a statement of principle here for this approach, insofar that we can. I know there are limitations about what we can do in these pharmaceutical assessments. So I start off with the first bullet point, a statement of the pharmaceutical services provided that are necessary to meet needs in the area. What does that mean? Because I might have one idea of what pharmacists can do, presuming we're talking about them doing more than just issuing tablets and other things on prescription. We should surely have learned during the pandemic that those frontline services of pharmacists could be doing a lot more to ease the pressures that we were hearing about from Fiona before. So what is the need? Is this the need to provide the service we have now? Is this the need to provide the service that should be provided from a frontline provider? And not just where it's provided geographically, because in some cases, the geography hides the fact that some of the pharmacies aren't accessible. So if I give you a good example, the Asda on Smithdown Road, the pharmacy is basically on the main road because that's where the supermarket is. If you go to the one in Knotty Ash, I think it's a Sainsbury's, and you're just going for your prescription and you're not very good on your pins, you have to go down the slope and it's 300 yards at the back, and then you have to get into the supermarket to use it. So yes, it's in Liverpool 14, I think, there, but it's not really accessible for a lot of the people that need it. So I'd like to ensure, insofar as we can, again, I accept the limitations, that we need to be plugging these points as well. And I wanted to introduce those today into the conversation.
Thank you, Councillor Kemp. Point well made. Yep, you taking that on board, Paula? Lovely, thank you. Okay, so is that agreed? Yep. Thank you. And then the last one we've got is Health Protection Subgroup, Matt, which you're just going to cover very quickly.
Thank you, Chair. Just to give you a quick update on the Health Protection Board. So we continue to meet as a board fortnightly, but with information shared in between. The role of the board is to look at the rates, the hospital pressures, look at vaccination, look at outbreaks, and look at the broader COVID management, predominantly at the moment, obviously during the pandemic, and to think about communication and engagement of key issues. Just to make the point that, as Councillor Lake was referencing earlier, you know, the COVID-19 pandemic very much has not gone away. Our current rates are around 350 per 100,000. Our rates in our over 60s population is 265 per 100,000. We've currently got approximately 176 patients in COVID positive beds in Liverpool hospitals, 21 of whom are on ICU or HDU, and we've had 17 deaths in the week up to the 13th of September. So we are still very much in response mode around the pandemic. The Health Protection Board is a very useful forum for dealing with these issues, and we continue to respond quickly. But I would also state that some of the issues we've had to deal with, including current vaccination rates, for example, there is lots more work required. So our current vaccination rates are approximately 69% first dose for over 16s in Liverpool, and 61% both a double dose for over 16. So I would urge everybody to get vaccinated, as that is the first line of defence against this horrible pandemic. Alongside that, obviously, we still have testing in place, and we encourage people to undertake rapid testing twice a week, which will help us identify virus at an early stage. And if people have symptoms, they should go for PCR testing and, of course, stay home and self-isolate until the results are known. Thank you, Chair.
Okay, and so if, obviously, as the councillors are here and everybody else is here, but councillors in there representing their local communities, if we have any ideas about how to up the vaccination rate, we feed them into you.
Absolutely, Chair, and Councillor Lake and I have been progressing that conversation.
Yeah, we've had a conversation as well, so that's great. Any ideas feeding? Go on, John.
I think it would be useful to see terms of reference for that board, because I think in terms of health protection, I think we should broaden it from COVID related, because norovirus is now a concern. Yes. And so are other respiratory conditions. You know, we've got real pressures in our system, more than we were anticipating this week. Today it is absolutely dire. So the more that we can do to advise the public, you know, hand washing, please. We've got to get the message out, especially amongst young people, because it's a major prevention, simple prevention measure that we seem to have forgotten in the message that we're giving around space, face masks, etc.
Thanks, Jan. Matt, do you want to come back?
Chair, Jan makes an excellent point. In fact, I would say the working of the Health Protection Board has been so successful that absolutely now our ambition is to retain that structure and to think about how we can capture and respond to health protection issues more broadly and make sure that Health and Wellbeing Board is updated around those issues. And you're quite right, of course, you know, winter is going to be very difficult. Actually, the Health Protection Board has been meeting at the same time as ourselves, and winter pressures was on the agenda for today. We need to make sure we have that consistent approach towards a winter plan, because we've taken RSV updates, we've taken system pressure updates, absolutely, and I think, you know, we all acknowledge that winter could be tricky for all of us.
Okay, the next, thanks very much. So thanks, Matt, for that update. The recommendations in the report can be agreed. Yeah. Okay, so the date of the next meeting is the 16th of December at 1 p.m. Now, if we...
I don't know whether you were going to mention the changing staff within the council.
Can I just talk about this and then come back? So the 16th of December, if however, things are moving very fast with ICS, we need to consider whether we actually will put a meeting together, extraordinary meeting on that, which I think that would be really useful to focus in on. But we'll let you know very quickly about that. Yeah. Sorry, Councillor Kemp, you wanted to finish.
So there's someone who isn't here today because he's on holiday, who won't be joining us again because he's leaving the council in about 3 weeks, and that's Martin Farron, our Director of Adult Services. So I thought we should record the work that he's done, and in particular the stresses of trying to cope, like anyone in the health and social care system in the last 18 months. I think Liverpool has come out of the pandemic in terms of the way it's corporately responded to the pandemic very well, and Martin played a key part in that, and I think we should record that.
Yeah, so massive thanks to Martin Farron, and he's leaving us on, did you say 3 weeks, another 3 weeks?
8th of October.
Sorry?
8th of October.
8th of October. Yeah. Okay. Yeah. Thanks for that reminder. So thank you, Martin, wherever you are. He's in the Lake District. He's in the Lake District. Yeah, he's in the Lake District. So, okay. So thanks. That was a long meeting, but thanks for all your contributions, and